It is interesting that George Eliot, deemed the British author who developed psychological analysis found in modern fiction, had this to say about animals. Animals are such agreeable friends. They ask no questions, they pass no criticisms. Clearly, there is a connection between the psychological needs of humans and the ability to meet those needs by animals, and this connection has spanned throughout history. Even from ancient times, the human-animal connection was recorded. Animals were used for war, companionship, and agriculture, but today their purpose is far greater. For today, animals are used to assist in the treatment of many mental disorders. In addition, animal-assisted therapy has shown many benefits to all people. Hello, my name is Abigail King, and today I'm going to be discussing animal-assisted therapy as a treatment for mental disorders. So, what does animal-assisted therapy actually mean? Well, animal-assisted therapy refers to the process of using animals as a therapy method. This can range to using them to assist in the treatment of mental disorders, to using them to brighten the days of people confined to hospital rooms or nursing homes. It is important to note that there is a difference between emotional support animals, service animals, and therapy animals. Emotional support animals, or ESAs, provide continual emotional support and companionship to their owner. These animals are typically owned by the client, which is what allows them to complete this role. Service animals are very different than emotional support animals. They have to follow a very strict set of guidelines, but mainly they need to be trained to perform a specific task. For example, if someone was suffering from schizophrenia and had severe hallucinations, a service animal might be trained to let them know when they're hallucinating so that they know what's real and what isn't. Service animals specifically for mental disorders are called psychiatric support animals, and all service animals are legally protected by the Americans with Disabilities Act of 1990. This allows them to go into public places where pets, emotional support animals, or therapy animals would not be able to go. Last, we have our therapy animals, and therapy animals can have one of two main roles. Now, they're often owned by either a handler or a mental health professional. So type A, as we're going to call it today, are therapy animals which are used in visitations to provide support to individuals in different settings. So these settings could include hospitals, nursing homes, schools, and other academic settings. This is not a goal-oriented type of therapy. Instead, it's mainly used to provide support, emotional therapeutic support, and other various benefits. Now, type B are animals which are used by licensed mental health professionals, and this is more of a goal-directed manner that's individualized to meet specific needs of the clients. And you also have to document progress with that. So these animals would be a measurable tool that would actually be written into the treatment plan. Animal-assisted therapy is not new. In fact, it has a very deep history. I'm going to briefly go over a few of the most important dates in the history of animal-assisted therapy. In 1792, we had our first recorded animal-assisted therapy session, and this occurred at York Retreat. By 1933, Sigmund Freud found that the presence of his chow chow, Yofi, calmed his clients. He noticed that when Yofi was present, his clients were more at ease, versus when Yofi wasn't there. By 1945, livestock animals were being used to provide support to soldiers at Pauling Air Force Base. And by 1963, Dr. Boris Levinson published pet-oriented child psychotherapy, after which the full animal-assisted therapy movement was started. And lastly, by the 1970s and 80s, many animal-assisted therapy organizations were founded and available to the public. As previously mentioned, York Retreat was our first recorded animal-assisted therapy session. Now, York Retreat was located in Yorkshire, England, and it was founded in 1792 by a Quaker of the name William Tuke. Unlike most other asylums of the time period, York Retreat supported the moral treatment of patients. And so, the same year as its founding, York Retreat allowed patients to spend time with domestic livestock. This was a push towards the moral treatment of patients, and as they began to show great improvement, other asylums began to adopt the same ideals as York Retreat. Many years after the first recorded animal-assisted therapy session, Sigmund Freud had his own findings. Freud noticed that the presence of Yofi, one of his two red chows, actually calmed his clients. Yofi would react to the patient's emotional state. He would rest his head on their lap and provide support during any emotional outburst. Freud also noticed that Yofi made a good companion for himself and actually improved his own mental health. Yofi died in 1937, but Freud continued working with his chows and took another one named Lewin. He continued this work because he noticed the benefits that his clients were gaining from having this animal contact during the sessions. It is evident that animal-assisted therapy has a very deep history, but I'm sure you're asking, what exactly does it do? There are many physiological effects of animal-assisted therapy, one of which involves the hypothalamus, pituitary adrenal axis, and oxytocin. Now, typically when you're hit with a stressor, your hypothalamus releases a hormone. It's called the corticotrophin-releasing hormone, which then signals your pituitary gland to release another hormone. It's called the adrenocorticotrophic hormone. This hormone then signals your adrenal gland to release cortisol, and cortisol is one of your major stress hormones. This hormone, along with adrenaline, prepares you for a fight or flight response. This is great for survival, but when you have too much of it, it's not the best thing. In fact, it can be very negative for your health. The problem comes when there's too much of it. But in people who have mental disorders, they often have a lot higher levels of anxiety, which means higher levels of cortisol. But not to worry, because there is a solution. It has been found that spending time with animals tells your body to release oxytocin. The higher your oxytocin levels, the lower your cortisol levels. And thus, animal-assisted therapy is very calming. It's great for anxiety and stress relief, especially for people who face it quite often. Yet oxytocin secretion isn't the only physiological benefit gained from animal-assisted therapy. According to a study published by a team of researchers from the University of California, Los Angeles, animal-assisted therapy can both lower your blood pressure and lower stress hormone levels, including adrenaline. In addition, animal-assisted therapy raises skin temperature and lowers breathing rate. There are also other physiological effects of animal-assisted therapy, one of which includes the secretion of dopamine. Now, dopamine is a neurotransmitter and a hormone that's associated with reward-seeking behaviors. I'm sure you've heard of a sugar high before, and there's a good reason that occurs. That's because consuming sweets actually increases your dopamine production and secretion. It has been found that these same type of behaviors actually occur when you see a picture of a puppy, spend time with any kind of animal, or really just be around animals. Your body is releasing dopamine, and thus you go onto a similar high by being around them. This can be a great therapy method because dopamine also has many benefits, which I'll talk about on the next slide. Did seeing the pictures of these little animals bring a smile to your face? Well, most likely your brain just released some dopamine. But that's not all dopamine does for you. It actually increases your memory, allows you to move more, gives you the motivation you need to complete work, and assists you in learning new information. It's evident that this hormone does a lot for you, and it can be very important to people who have mental disorders. There are also non-physiological positive effects of animal-assisted therapy. Animals provide a safe space for anyone to go to. Animals are completely non-judgmental. They won't judge you based upon how you interact with them. They also act as an emotional anchor. You can bring all your problems to them. They're wonderful listeners, and no, they don't ask questions or pass criticisms. And it's been found that they can also help individuals to feel more confident. So I'm sure you're wondering, why exactly can animal-assisted therapy help people with mental disorders? Well, animal-assisted therapy is calming. As mentioned earlier, the physiological benefits of animal-assisted therapy actually lower anxiety and stress levels. In addition, animals provide an emotional anchor. They're there for comforting whenever any emotional outburst arrives. Animals also provide unconditional friendship. It might be hard for someone with a mental disorder to make friends, and thus an animal can always be by their side. Animals also can assist with confidence. As you see in this image, this is an autism therapy dog. This dog will travel with children to help them gain confidence in interacting with their peers. Animals also provide a sense of responsibility. Even having someone with a mental disorder learn how to feed, care for, and walk a dog or another animal can be very beneficial for them in the future. Before I conclude this presentation, I wanted to briefly discuss diversity within therapy animals. Any animal can serve as a therapy animal as long as they can complete their job effectively. Based upon the client's needs, a different animal might be better for an animal-assisted therapy session. One client might need to work with horses while another needs to work with a cat. It all depends on the treatment plan and what the client is in need of. In conclusion, we have discussed the history of animal-assisted therapy, some of the physiological benefits of animal-assisted therapy, and why this is a great treatment for mental disorders. Here are my references for this presentation, and I would like to thank you all for listening.